What's up, everybody? It's Mike. We're back here on the Pitch Please podcast. And today I'm here with Luca from Docere Health. They're an AI based solution to help new medical school grads and other physicians streamline the setup of their new clinics. I'm very curious to learn more, but before we do, it's time to learn a little bit about Luca. Over to you, Luca. Let's introduce yourself and a little bit of your role at Docere Health and a little bit of your own background as well.
Of course. Thank you, Mike. It's a pleasure to be here. Thank you so much for inviting me. So, my name is Luca. I'm 23 years old, biochemistry student in the senior year. I did a lot of research in my life, mostly in neuro-oncology and a little bit of proteomics and genomic medicine. I partnered with a lot of people, with a lot of professors, especially from Cambridge University in UK. And lately, decided to spin out or to start my own company called Docere Health. I'm the CEO and co-founder. I come from usually what I say, especially in these occasions or in these shows, podcast shows. I'm proud to be an immigrant, and I come from an immigrant family. We came 4 or 5 years ago here in Canada from a small country called Albania that is in Eastern Europe. And yeah, I'm very excited to talk a little bit more about that, about my background, and also a little bit more about Docere Health, about my company.
Amazing. Well, like maybe we start with you're doing stuff in healthcare, but you're obviously an entrepreneur. Let's talk a little bit about your background in science and chemistry, and maybe what veered you off that path to become an entrepreneur, or maybe somehow you were an entrepreneur at heart way before there. Let's talk about that story of like what kind of kindled your spirits to build something for yourself and go into things that were healthcare adjacent, but not directly related to where and how you were going down a path for education?
That's a that's a very good question. I mean, let's start from the beginning, I believe. Let's start when I was in high school. So my love for science and my love for healthcare came very, very early in my life, uh, even before high school, actually. My mom is a pediatrician. She's a physician. She used to bring me with her in the hospital when I was a very small kid, and she used to leave me like with lab technicians in the lab work. And I loved lab. I loved being there. I loved the environment. All I knew was like science work, right? So I got kind of like I grew up with that feeling of science and of healthcare. Being raised in a country where, man, like even research, healthcare research doesn't exist. It doesn't exist. It's very, very, very minimal. Imagine entrepreneurship. Like entrepreneurship in Albania, it's when you tell to your friends, "Oh, yeah, I'm an entrepreneur," they say to you, "Are you dealing drugs?" Like they don't. They it doesn't exist as a word. So growing up in that environment, I never thought I would start my own company, or if I did, it would be something very simple, like I don't know, a traditional business, like a restaurant or something. But I never thought in the startup world or actually bringing some innovation into the market. In high school, I had some kind of like some roles when I worked with a lot of physicians. I worked in the hospital, and that really made me love the idea of becoming a physician, a doctor myself. Also, for my mom's background, so I said, you know what, that's the smart choice to do. So I came to Canada. I applied to university. I got chosen for biochemistry slash pre med, and my goal was to become a doctor, and more specifically, a cardiologist. That was kind of like my goal in my mind. That's what I had. Uh, the idea, the problem is that when I came here, I had the pressure from my family, to be honest. Like, they're my biggest supporters now, but in the beginning, they, as every other immigrant family, they pressured me to either study engineering, law, or medicine. So I chose medicine, right? So uh, all I wanted to do was become a cardiologist, become a doctor. When I came here, I got opened up to a lot of other opportunities that I didn't even know that existed. Here, you can become a researcher. You can become, I don't know, you can work in a lab. You can work in a startup if you want, in biotech. You can work in a lot of ways. You can have many different careers. And also, you can have your own startup. You can create your own innovation. So, this was the first culture shock that really changed my life and changed my idea. And it really convinced me in a way that, hey, maybe my life is not only becoming a doctor, but I can become just a researcher, right? So I started doing research. I started exploring myself. I worked with some professors. I worked in different research papers. And I found out that that's something that I love. I really like. I really like research. I really like working in the wet lab. But the second moment that it really changed my perception of life and my perception of healthcare industry in general is the moment that my mom, as I said, a physician for around 20 years, burned out at only 45 years old. Not only she burned out, but also she retired after burning out. This was something that really showed me how cruel and how bad sometimes healthcare system is. So that made me decide to, as the typical same roadmap as I was doing research, I started doing research also about this, and I found out shocking statistics. I found out that there are 10,000 doctors that burn out every year only in Canada, and 80% of the doctors in US, 80%, that's a scary number, of all physicians from all specialties would said that they would retire tomorrow. So I know that this might not sound anything crazy because every profession, even you, even me, like if we say, you know what, Luca, you're gonna, do you want to retire tomorrow and just do like whatever you want? Of course, I would say yes in the first answer. But medicine is something that is just more than just money or more than just, you know, uh, career or more than just status. It's actually helping people. It's a different kind of profession when you directly help people. So that's why it's so terrible. It's so shocking for me. And that kind of became my life goal and my mission. And that's why I started Docere to combat the burnout, the doctor's burnout. So it was maybe not, it was never in my mind that I'll become an entrepreneur. It just happens. And I still don't like when I call myself an entrepreneur. I just like the idea of me bringing innovation and creating a business behind it.
Let's talk about that for a second because I want to talk about the parallels. When you came here, you said that you kind of spoke generally to the fact that you saw these other potential career paths, entrepreneurship, people doing a startup. Was there like specific examples of things you saw that were memorable that you were like, maybe that's what was my hook, or maybe that's the startup or two that I was seeing that changed my perspective? Like broadly, you saw this opportunity, but there has to be things that spoke to you. Talk a little bit about that for us.
That's a very good question, and that brings me back a little bit in time and in my memories. So in the beginning, when I came here, as I said, I was in university, I was on campus. I became friend with with Zach, who is also my best friend today. And when I talked to him, like this is something that I don't share a lot with people, but when I talked to him, it was very genuine. Right, I was like 18 years old. I didn't know what I was doing. I was very confused, even though I knew I wanted to become a doctor, but still deep in my mind, as you said, like generally I knew the opportunities that were there, but and that confused me. That I was like, oh my god, what should I do with my life? So I met this guy called Zach, who was shout out to Zach right now that most probably is going to listen to this.
Shout
Uh,
out Zach.
he he introduced me to the concept of content creation, which I never thought there would be a possibility for anyone to do. And I saw him because he's a chess player and he monetized chess. He became a chess influencer, right? He started playing chess online and he started playing chess on Twitch, and he became very famous. He's and that really opened my eyes, and I was like, wow, he's my age and he's doing so many great stuff. And he started very humbly without nobody putting into it, just sweat equity basically. Then he took some risks and then he did it, right? It took a lot of years, but he did it. He did it in a different way. And that was the first, again, that was the first culture shock. That was the first moment when I had some good ideas in my mind. So, inspired by Zach, I started my own podcast, talking about podcasts, which was based on my love for history. And it was called Cool Historians. I made it happen to go to 55 countries, listen to 55 countries in the world. And that was actually my first, even if I didn't know, I was just doing it for fun, basically. But that was my first moment when I realized, you know what, this is the entrepreneurship world. This is how it is to create your own thing, basically. Not a company, but your own thing. So after that, because I started doing it, and this is a very important keyword, I started doing it, and I put it myself into different situations and different sections and different environment. So, in my opinion, environment is very important. Being around Zach helped me a lot, but not only that, but also looking for a lot of founders and a lot of people that think like me, people that are very non-conformist in a way, right? They don't want to do the traditional way of doing things. So that it put me into a lot of friend groups, and I met a lot of people that showed me that hey, it's possible. It's possible. You don't need to drop out sometimes. Maybe you want to drop out, but you don't have to. You don't need to finish university. You don't need the PhD, which is a one of the biggest I would call it the stereotype that a lot of medical students have, that you need a PhD or you need an MD to create your own thing if you want to create, because you need credibility. Uh, I try to do it without the traditional route of doing it. The other moment that really changed me was when I met my professor Agostino Mena, who is also my mentor right now. He also I had the idea at the time. I had the idea of Docere Health. Uh, it was very raw, very vague. uh, I met some people in hospitals because I used to live in Montreal before. I met some people in hospitals there. They said, it's okay. Like, you need a little bit of refinement, and then you have to build a product and then come to us, right? But Agostino really helped me a lot with understanding how entrepreneurship and how the world works. He introduced me to the concept of MVP, minimal viable product, which was the first time that I heard about it. And that was actually when I accelerated my Docere. I left behind my podcast, what I was doing at the time, and I just focused on Docere. And with the help of Agostino, he invested after into the startup, $25,000, which was our first check. And that was the motivation that I needed to really focus full time on the company. So pretty much it's a combination of a lot of different factors, like my mom being one. My Even the research that I did was very, very helpful because I learned a lot of problem solving skills, but especially the people that I met with my immigration here in Canada. The first people that I met were very crucial.
That's impressive. So the people had a very big impact on this. If we go back to Albania, I want to just touch on something you said to parallel and understand. You said, when you lived in Albania, no one builds a startup. No one is really this concept of entrepreneur unless maybe it's a restaurant. And you said the environment was different. There, you become a lawyer, a doctor. And here it changed your possibilities. Can you help me understand that? Is it there's less opportunities, less ideas of innovation, less openness to the idea? Maybe like what are the elements that maybe are different here that people should really take for granted that maybe they don't realize is so different in other places around the world?
That's again another very good question, because I have this conversation with a lot of my friends that live here in Canada, especially young people, and I tell them, man, you are so lucky to be born here and to live here all your life that you don't understand. I know I might sound a little bit cliche, but North America, for real, it's the land of opportunity. It's the land where you can really become successful just by having a dream, as Walt Disney would say. Uh, you know, in Albania, and maybe not only Albania, Albania has changed a little bit. We have some tech right now. We have some innovation happening there. But even Europe, I would argue, some, or at least some pockets of Europe, they are very, very not open to the idea of taking a risk, that's where it starts first, right? Because starting a company and starting a business, it's not easy. I know that people say, "Oh yeah, well, I'm an entrepreneur." It's not easy. You creating this podcast, it's very hard work. It's a lot of risk to take because it's taken from your time, right? Me creating a company, it's a lot of risk to take because I'm putting my name there and I'm wasting a lot of time and a lot of money, which might result in a failure, right? But that concept, this mindset that Theodore Roosevelt said it very right on his speech when he mentioned it's it's enough to be the man in the arena, to just be in the arena. It's enough to live a very worthwhile life to be lived, right? Uh, Being the gladiator. This concept is very, very, very apparent here in North America, mostly U.S., lately also in Canada. Uh, the openness to create, even if you are young, even if you're a kid. I met a guy in San Francisco when I went. He was 16 and he already exited two companies. It's unbelievable. It's unbelievable. Like, this concept being discussed in Albania, in Greece, in Serbia, in Balkan countries, but even in Italy or in Germany, my co-founder lived in Germany all his life. That's what we discuss all the time. No one thinks about that, of course, because it's a lot of more it's a lot of more bureaucracy, and it's a lot of more traditional way of thinking, which is good. We need that. And again, I love people that go through the traditional way of doing stuff, like doctors and lawyers and engineers, because we need them. But there are also some people that are non-conformists that really are stubborn to create what they want, and this is the opportunity that North America gives to you. So, if I one of the advices that I would give to everyone, to anyone that would want to start something right now, that live in Canada or live in US, because these are the industries or the markets that I know best. It's don't think twice. If you really want something, don't think twice of it, but also be prepared for the risk that you're taking. Because even though here it's the land of opportunities, it's also a very harsh world, a very wild world. Like, no one is going to let you disrupt healthcare that easy, or fintech or finance world that easy. So you have to be careful of what you're wishing or what you're asking for.
It's great perspective, and I think it's helpful for people to understand what's different here. They might think, on first jump, we just have more resources. I think what you're saying is it's not necessarily more resources, it's just a more open mindset to risk and being surrounded by people that will appreciate and understand and empathize and support that risk. But the risk is the thing. Let's talk a little bit then about. I'm going to want to talk about and hear the pitch on Docere. I'm saying it right,
Yes,
Docere.
Docere Health. Yes,
I, I'm curious. The name, where does that come from? I called it Docere. I think at the
it's
beginning
the
is
same thing. It's the
Docere.
same thing. It's the same thing.
It's
It's not a
similar
problem.
idea, right? Okay. So what's the background on the name, and is it related to what you're going to tell us when you start to pitch us on what Docere Health does?
Not directly related, but it's a little bit personal for me as a name. So I remember I was reading Plato's The Republic. I love philosophy. I love reading philosophy books. It's something that has helped me go through very hard times, also with my business, but also in my life, to understand how to act in different situations. So I was reading this book from Plato, The Republic, and he mentions Hippocrates, that is the father of medicine. And they mentioned there in this chapter the word docere. I got fascinated because it was the only word that was different from English, that even the translators didn't translate it on purpose. Even the historians didn't translate it on purpose. So I went to search it on Google. What does it mean? And it meant to teach. It's a word that is come from Latin. It meant to teach, but it was a word that was used for physicians, for family physicians, because they were considered to be teachers of the and enlighteners of the society. So it was amazing, and I loved it. I love that word, so that's why from now on I told my mom and I told my my co-founder, you know what, we're gonna use this name, and
That,
that's it. End of story.
that
I
that's
and I put
amazing.
the
So was
health.
it a natural? It was a natural fit of a word that you knew, or did you start working on the company and then just coincidentally were reading some things that brought you to this name? I'm curious. Did the chicken before the egg? Which one came first?
That's funny. No, it was actually we had the idea and we started working on it. We didn't have a name in the beginning. We're just working without a name because the name is not as important. You can name it whatever in my opinion, at least in a startup. I know that marketing is super super important, and I know that now that we have the name, it's very very personal meaning for me. But in the beginning, the name is not important. You just have to build. You have to prove your point basically. So it came after.
I love it. Well, let's talk a little bit about Docere Health then. So you're on the Pitch Please podcast. So Luca, we're gonna start with your best pitch, please.
Of course, of course. So Docere Health is an AI centralized dashboard that help doctors manage, but also create their own private and or personal clinics. Uh, this management happens solo; they don't need any help. So what I mean by this is we help doctors automate a lot of their workflow, starting from intake forms and ending with the medical referral letters, including clinical decision support tools, which means uh, diagnosis, prescriptions, medical, as I said, medical referral letters, all done by AI. The doctor just approves. So we help not only newly graduated, which is our first target, medical students that they want to create their own thing or they want to manage their data or manage their operations better, but also I would say older generation of doctors which are more established, save more time and combat the burnout. We are bringing also lately focus on precision medicine. We're training our LLM, our AI, on precision medicine that helps doctors and help all the physicians from different specialties for each patient that comes to the clinic based on different parameters like EHRs, the research, the drug discovery research, the lab tests, focus on precise diagnosis for each patient that comes to the clinic. So AI does everything for them precisely for each patient. And we have done this for a while right now. First results from this latest pivots or latest iteration of the product came in, and it says that we have we have saved doctors around 2 hours per day and increased their revenue by at least $1,000 per day.
Wow, super impressive. Um, I want to understand this space a little more because I'm following your innovation, but I want to see where it fits in. You said things like EMRs, and maybe what we'll do is as we go through some of these things for anyone that's not deep in this space, I know an EMR is, but they may not. Help me understand like the space and the existing technology that exists, and which of it are complementary potentially to what you're building. Like, do you work with these things? Do you work in replacement of some of these things? Help us like learn a little bit about tech in the everyday physician office here in Canada or potentially in North America, wherever you're serving.
Of course, I'm a big believer on digitalizing healthcare. So basically, the whole industry of digital health, and I know the industry very well. So I know that. So for example, we work very closely with EMR and EHRs, and a lot of physicians, mostly all physicians right now, use EHRs and EMRs for the data, at least for data collection. The problem is that they don't have a lot of time to read all those data, and even if they do, before the patient comes into the clinic, and I'm talking specifically right now for family physicians, even if they do, they don't have time to link it up with research and then understanding, going back to the lab test, and then going back to another thing that maybe it can kind of defer the result or defer the diagnosis for each individual patient, right? So that's why we created also Docere to help them with this thing, to help them not think about this stuff, but just focus on actual. I usually say that we're making doctors have a little bit more of a passive role, but not in the sense passive that they don't care about patient care, but actually care just about patient care, not care about other stuff that happens in the industry, right? And that's and they have a little bit more of understanding and fixing a lot of complex problems. I just had a call last week with one of the doctors that we are hopefully we are in contact right now to join as our new CMO, which was also our first user of the pilot. And he said the same thing. He said, I don't want to deal anymore with small stuff, and I don't want to deal with with not understanding what the patient is going through and focusing more on the administrative tasks, on the stuff that I can do basically like a nurse practitioner can do those, right? I want to understand more on the complex problems, on fixing the complex problems right off the bat when the patient comes to the family physician, fixing most of those problems. And then, if we cannot fix something, we can send it to a specialty. But this is how we fix the healthcare system, by fixing the problems right off the bat. And I believe precision medicine is something that it's very, very valuable and very good to follow. We have in our board our research advisor and Dr. Tetina Zali. She was my PI, and she's an amazing scientist. That she's a professor at University of Cambridge. She's affiliated with Cambridge University, and we are using her research as part of training our LLM. Now, this is kind of like a parenthesis before we continue on the technology that is available today, especially in the Canadian market. There are amazing companies, and I can mention some of them if you don't mind. Uh, EasyScribe by MedX Insights is unbelievable. Uh, AIMD, very cool. Acefa. So there are Aseva works with pharmacists mostly, but they also work with clinicians sometimes. But there are a lot of good companies that focus in innovating or automating or helping doctors in different pockets of the workflow. Uh, and and I'm open on working with all of them. I know all of them, all the founders, and they're amazing, amazing founders. And I believe the best way that we can fix the healthcare system is by collaborating with each other. That's why I hosted a digital health conference, actually in partnership with Microsoft, with Reactor, uh, because I really wanted to create this new era of stop competing but collaborating and making the healthcare system especially for Canadians, a better place and a safer place for the patients.
So do you today, does Docere Health integrate with those other companies, or you're solving different aspects of the problems, you just share notes? Maybe explain a little bit about that for
So, for
us.
example, with one example with EasyScribe with
Yeah.
Shreyas, that is the founder, we work together. Basically, we work very closely together. We don't necessarily integrate yet. I'm sure we're going to integrate in the future because they focus on the scribe moment. So basically, the note taking moment
Mhm.
between the doctor and the patients. And it's something that we might for sure use their data for, or the data for our own LLM or for our own AI. So, but we, even though we don't integrate yet, we still share notes. I still recommend him to the clinics that I work with. Hey, there's this cool guy. Maybe you can use him too because you're using us, right? So this is things that we do to help each other to grow, right? Uh, with EHRs, with electronic health records, for people that don't know what EHRs is, uh, we're already working. We're already integrating with a lot of them through their API. So it has been a very, and this is what I love about Canada, because people here tend to help, and the acceptance that we had from EHR companies here, which are the same in the US too, but the affiliation here are so much open to innovation, and it's crazy. I thought it would be the vice versa, but it's actually who they're helping us a lot. So the collaboration opportunity is there. I think we need to, because AI in healthcare and the innovation in healthcare in general, it's a little bit new. To be fair, it's a little bit new. So we just need to create a little bit more established companies and a little bit more robust platforms, so that then we can create a big. This is my dream. I'm dreaming right now, but a big committee where we can integrate all our platforms together and we can make the healthcare system better.
That's cool. Now, you said, or maybe it was I said, or we both sort of said it a little bit at the beginning that, this is targeted at, new grads looking to set up a practice. But as we talk about it, what I'm hearing is it's probably for any independent physician that's opening a general practice, I guess.
Yes.
Can you talk to us about like who that target audience is? Is it GPs or general practitioners and family doctors? Is it for new grads or existing clinics? Help me understand a little bit about who that's for.
So the whole the whole inspiration for Docere, the whole mission that I had was through my mom. And my mom was a pediatrician which had her own clinic, which is a little bit unusual, but what I saw, the same problem as my mom had, a lot of family physicians have. So our primarily target would be family physicians. And the reason why I say the newly grad a lot, and why I empower the medical graduates to start becoming active and start becoming having their own patient roster, because we need that. We need. There are a lot of patients, a lot of Canadian citizens which don't have access to healthcare, and we need more family physicians to have these opportunities, these resources, to make it easier for them so they can accept new patients. So that's why I empower them, and my goal is to bring more medical students into family physicians, into creating family physicians, and family physicians having their own clinics, basically, or making sure that they can control and don't burn out, right? That's kind of like my sense and my worry with a lot of family.
Got it. Like you want to capture them early to help them on
Exactly.
that journey. But people
Exactly.
who are already on the journey could use it too.
Of
It's
course.
just your
Oh,
dreams
absolutely.
that
And we have.
to help the overall flywheel of the healthcare system.
There is a concept in that Y Combinator says it very well. Hair on fire. So who is the hair on fire in this situation? So basically, hairs on fire is like when you have, someone has like its hairs are on fire, and you give them a brick for 100%, they're going to buy it for you because they think it's going to help them, right? So who is it, in such a bad position right now, they're going to use the platform first? There are two ICPs, two ideal customer profile that we're focused on: family physicians, or every type of physician, to be fair, that is in different specialties, who is up to here with patient and administrative tasks, and they want to try new things, and they want to open up to you ideas to help them, again, save 2 hours per day, which is a lot of time. And young generation of medical graduates that just came out in the industry, they don't have a lot of years of experience, and they're trying to create their own thing, or they're trying to become better physicians. We help them too. We help them not to burn out, not to focus a lot on business or sorry, not on business, to focus a lot on administrative tasks or on tech. Focus on your patient care, the thing that you love to do the most. So that's kind of like our goal and our hidden mission in a way, because we don't usually say this, but we really, that's what we're trying, what we're trying to accomplish with Docere.
Got it. Well, maybe let's talk a little bit about the components of Docere Health. You kind of skimmed on them at a top level. If I subscribe to or whatever your pricing model is, we'll talk about that in a second.
Of
What are
course.
the components as a physician that I should be thinking about leveraging in my everyday practice? Where does this fit into my workflows? What are the ways that it helps? Talk to us a little bit about that.
Yes. My co-founder Ervis, he is very obsessed with UI UX concepts. So he always tells me to say this when people ask me this question. With 2 clicks, you just go you can do your job basically. So you have everything that you need. Uh, it's very simple for now. Like it's just a dashboard, which the dashboard is actually the main component of the platform. And in the dashboard, you have different type uh, of, 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 of tools that you can use. Not a lot, like 3 to 4 tools for each workflow part of the position or part of the system. So you have a automation. We have an intake form place where you have all the intake forms and you can read them if you want. You have a EHR, which integrates immediately with the EHR that your clinic or your hospital is with. And after that, you just have the data, you have the medical referral letters that are ready to fill basically. And since the moment that the patient approves or writes the intake form, the AI starts its generation. You press generate basically. It's very similar to ChatGPT's UI UX. You press generate. It takes into consideration all the parameters that we talked before, and it gives a situation of the patient. And then after we get also the scribe and the note taking component, it gives also a potential diagnosis and a potential prescription, which again the doctor can approve or disapprove. It's up to them. They can edit. They can see the files. They can see whatever they want. Most of the time they approve because it's pretty accurate. And yeah, that's what the components or the tools right now are about. So we start from the intake forms and end to the prescription, diagnosis, or the medical referral letter.
Got it. So the
It's pretty
data that
straightforward.
you are inputting into the input form, plus the observations and notes of the physician, come together to start to recommend what this might be, what the next step might
plus
be, what
plus
the
the
solution might
research,
be.
plus the EHR, so medical database is
Got
precisely
it.
for you, plus the drug discovery research that has been done by other pharma companies. We do
Got it. So it
everything like
taps
that.
into lots of things.
Data diffusion of all these parameters, and we bring a precise diagnosis for you, basically for each patient.
Got it. Got it. Totally makes sense. Now, we might as well not skip over this part, but what types of the EMRs does this integrate with, and what are the main ones in case someone's listening and like, oh, I think there's one from like TELUS or there's some other
Yes,
ones. Does it integrate with those? What are the ones it does integrate with? So if I'm a physician, I've already made a decision. I'm not starting at new. What does
yes.
Docere already work
So
with?
we're working very closely with Epic because we needed to,
Okay.
because we're trying to work with some hospitals too about this, especially on the second component of the platform, which is the AI. We we integrate with every EHR that you need, as long as as long as it is used and it's legal in Canada. So don't worry about that. There are a lot of ways that we can work with it. We don't take data from the EHR, at least not yet. Like we didn't train our model based on EHR data. Again, not yet. But they can have access to the EHR medical databases whenever they need to, whenever they want to, which is it's exactly like the minimum that we can offer them to. But how the AI works is we work precisely with autonomous data on precise, for example, for Mike, the mic that comes in. We don't touch all the data of the whole patients that this EHR has, right? So that was kind of like the trick that helped us with a lot of this to make the process faster. Because work with the EHRs, it's a little bit of a longer process, and to make it shorter, to make it easier for the doctor to just integrate their own platform, or at least have their own platform there or their own EMRs, they can do it there. So what I mean by this is we can work with TELUS, we can work with Epic, we can work with all the EHRs that the doctors need to.
Amazing. Amazing. And so how does your How do you make money?
That's
Where within this process? How much do you charge? Do you charge by clinic, by physician? How does that work today?
so we have different pricing models because we work pretty differently. Like, for example, we cannot price hospitals the same as we price clinics because hospitals have way more patients and way more data together. So what we do is we have a simple basic package of $5,000 per year for physicians, which they pay. And there, how we try to kind of like how we try to justify this pricing because it can seem like a lot, but we say, hey, in these 2 hours per day that we save you, you can choose to just make money and you can pay off this $5,000 in just 5 days because we actually increase your revenue by $1,000 per day, right? So that's kind of like how we how we try to justify the pricing. Uh, that is a $15,000 and a $25,000 package. $25,000 has all the AI needed and everything that we need to make even the decisions better. Not just the automation and helping save time, but also the decisions make it better. So that's pretty much the packages right now for clinics or for physicians. And we usually charge per physician. Now, there are cases where the clinics have like 5 or 6 physicians. We try to talk and to negotiate with them because I know it's a lot of money like that way. So we try to negotiate with them and find the best package possible. We can charge them like how we charge hospitals, which is per patient.
Got it. Oh, and so the hospital model is a per patient model.
Per patient, yes, per patient, because again, it's there are a lot of physicians which are in different departments. Right now, what we're looking at in one pilot that we're doing with one hospital, it's two departments: the family medicine department and the ER emergency room department, because they are the most needed ones. I think that need our platform. So we're discussing two opportunities, either per patient or either one big that the administration has access to, which is a big contract basically.
That's cool. Obviously, healthcare. You had background in this, but it's not an easy place, especially in the Canadian market, to make significant ground. Especially in the newer world with AI and all these other components. What's been the hardest part of your journey so far?
Oof. Uh, you know, I know I don't want to sound too philosophical or too cliche, but it's actually fighting with yourself and convincing yourself that you can do this. Of course, it's healthcare. It's maybe one of the hardest industries to get into. Man, it's like it's impossible to disrupt. I'm going to tell you a story. I'm not going to say the name of the guy or the name of the institution that he works with, but I talked with it's a hospital. It's a hospital, but I'm not going to say the name of the hospital. It's a hospital that we talked to, and I asked him. I said, "How many?" So I pitched him the company, and I pitched him whatever we are doing, and I said, "It's this." And he was like, "Yo, this is very cool. I love it." He was a young guy. He was a director for it. He was very very successful, very smart. And I told him, "Okay, like let's work. Like how many time do you need from today to implement to the department of the hospital uh, our application, our platform?" He looked at me and he was like, "Luca, like I don't know about the departments, but I can tell you about the whole hospital. You know how many years you need for that to happen?" I said, "I don't know, 2 years." In my mind, 2 years is a lot, by the way. 2 years for a startup to go into a hospital is crazy. He was like, "Go up." I was like, 5 years? Up. 7 years? More. 10 years? 15 years, he said. So from the moment that we come up with a platform and we present it to the hospital, it is 15 years to fully integrate the whole hospital. Unbelievable. Unbelievable. And I get it. It's a very traditional and very bureaucratic is the industry, which it should be because you're dealing with patient care and with life of with patient life, right? But the from the side of innovators and the side of entrepreneurs is very hard. It's very hard because you have to deal with a lot of bureaucracy. Said that, it's also a very exciting industry because the moment that you innovate, you can actually save people's lives or you can make people's lives better, which is what we're trying to do, make people's lives better, right? So it's a direct impact. If people that are obsessed with impact, which I am, it's a direct impact into the people's lives. And I said dealing with yourself or fighting with yourself because there are a lot of times where you're gonna be like, man, why am I doing this? And I say this as maybe once in 2 days when I wake up, like, why am I doing this? Why should I go to this such a hard journey? I met a medical doctor who created his own startup, and he told me that creating a startup or founding your own company in healthcare, it's even harder than medical school. So, you know, people have this glamorous idea that when you're an entrepreneur, you're gonna be rich and you're gonna be successful and people love you, but it's not really like that. It's a lot of dirty work that you have to do, especially in the early days, manually doing stuff that's like calling the doctors, calling clinics, calling hospitals, calling experts, going to events, pitching, thinking to get investment, sales, marketing. So everything you have to do it yourself, coding, and but you have to learn how to fall in love with the process and fell in love with this first days of the startup, because these are going to be the most beautiful days. At least that's what people say, right? So uh but to understand that, you need to have a lot of you need to be very humble, and you need to understand that, okay, you know what, you are in this position, you hope it's going to be better, you are doing this for a mission, and never forget your why did you start this, right? There have been time, and I tell this a lot, just not to victimize myself, but more to inspire people. There's been time, or to tell them that you are not alone. There's been time when I have spent like one week and some days without food in my house, eating just like literally garbage, like $1, $2 food, uh, just because I had to go from, I live in Niagara Falls, so to go from Niagara Falls to Toronto, you needed to pay the go bus, so I had to pay for the go bus. So these are things that people don't understand and people don't know, right? Uh, Most of us immigrants, and some of the international students, for example, they have to deal with this without the support of their parents, the emotional support of their parents. They're in a new country completely, right? These are things that bother a lot of people and annoy a lot of people. But again, if your mission, if you really want to do it, you got to do it. It's just your heart will tell you to do it. So uh, the hardest part that entrepreneurs to go through is this personal journey of, should I really do this, or should I really go through this journey, or should I just stay the safe way and become a coder or become a doctor? That's like what you have to decide.
Is there any advice you have on that bit, like how to help determine if you're gonna have what it takes or when the right moment is to proceed down that? And similarly, I think you've had some experience in the challenges breaking into the healthcare system, which have obviously come back to your own personal journey. Are there any like elements of, I don't want to say like the magic recipe, but if someone else was starting from the scratch to innovate healthcare, which it sounds like you want to really help enable,
Of course.
are there any things they should consider to help accelerate that or drive success earlier on?
Be good to yourself. That's my first one. Mental health is very important. I was in a conference in the Young Entrepreneur of the Year awards, uh, and Jay Carls, which who was one of the entrepreneurs that were in the panel, he said something very important. He said that he used to go to the therapy like at least once a month when he started the company. So be very good to yourself. Take care of your mental health. You should understand that you are not alone, and things that you go through, you are not alone. There are a lot of people, not only entrepreneurs, but even people that are trying to do something big in their own field. They're going through this, right? So try to be good to yourself. Surround yourself. This is my second point: is surround yourself with very good people that will not only like push you, but also you can learn from them a lot. They can teach you stuff. They can teach you how to act in different situations because you need them. You need them. I know that a lot of people say, "Oh yeah, I'm a lone wolf and I'm Rambo and I'm going to do this all myself." You can't on long term. You can in the short term, but long term you're gonna get burned out. And I almost got burned out like this. I'm talking from my own experience. Huh? Like I was the lone wolf guy. So in April I almost got burned out and I got very very sick. And it's ironic, right? It's paradox because I'm fixing the burnout of the doctors and I'm not taking care of myself. So it's very important in my opinion to really focus on that and never uh, giving up in the sense of not like again not the cliche of never give up, but being the man in the arena is enough. So you trying and you really pushing every day to do whatever you want to do and to disrupt healthcare and to help make the healthcare system better, that's for me is enough. You took the risk. You are far better than what a normal person is doing, right? So don't be so harsh on yourself. That's also kind of like an advice to myself too. So I'm kind of like speaking to my alter ego in a sense.
I think that piece that you mentioned is really important, which is like you do have to look after yourself, whatever that is, to take some time to recover, to refresh. Putting your own oxygen mask on an airplane is super critical because if you don't, you can't help anyone else. Um, I, Obviously, it's been a bit of a journey. What's the year ahead look like for you? Are like you're obviously making some amazing progress. What are your like lofty? We're tailing out 2023, so let's say your 2024 goals for Docere.
We're growing a lot. We're growing very quick. We're getting clinics. We're getting hospitals interested. Right now, for us, it's the moment that we do things at those scale. I think we have that problem solution fit. Now we are in the journey to hit that product market fit, which means they can be Series A, Series B. I don't know whether it's going to be hit, but for sure it will. In my opinion, it will be hit at some point, right? So, I guess what's the next thing is doing things at that scale, focusing a lot on getting a lot of clinics here in Ontario, in Quebec, in British Columbia, so basically in Canada. That's at least for the 1 year. Growing, so we have a lot of clinics that we did pilots with. Some of them are just we just recurred and we just them to turn into paid pilot or paid clients. Getting all of them to get into paid clients, it's like the next more practical goal, I would say, right? Uh, Now, if you're talking about more long term, of course, going to the whole North America, that's very very important, and actually helping more startups into a healthcare journey and that are in their healthcare journey through our LLM, through our language model, helping them get funded and get created, and helping them integrating our LLM into their systems. So that's kind of like the big dream or the big goal that we want to.
That's cool. So obviously, in the immediacy, it's converting to paid,
Of
helping
course.
expand continued usership in Ontario and Quebec mostly. And on the longer term, how can you help bring others on this journey and expand into the U.S.? If there's anyone listening that is interested in helping support your journey, is there anything specific that you could use as assistance or help to accelerate the year ahead for you?
That's a good question. I mean, every physician, I would say, that wants to have a better life and wants to make more money and wants to go home a little bit earlier and maybe just wants to make better decisions in their life and help patients become better, just reach out to me on LinkedIn, on Instagram, Luca Lamai, LukaLamaj, like the name of the podcast. Reach out to me because it's going to be beneficial for not only for you and me, but also for the patients, which is very very important. So that would be the only assistance that we need right now. Of course, the usual investors and the usual, I don't know, like people, but that really, and everyone that wants to, we're opening soon some job openings. Everyone that wants to contribute, especially in AI engineering field, please reach out to me because we'll be open to hire new AI engineers and to to make it basically to make the platform better and to make the LLM better.
Got it. So you're looking for you got some immediate hiring around some AI engineers.
Yes,
You're obviously looking for referrals, or if someone's listening that is a physician, continued utilization of your product to help impact their own lives, but also the lives of those they're helping. Put your oxygen mask on first, save some time, increase your profits, reduce burnout, but also provide better care. If people are looking to find out more, they can obviously connect with you, and we'll include that in the description. Where else should they go, and what's the link we're going to put in the description of where people can go if they'd like to sign up themselves?
for now it's been very manual for us. We have a
Okay.
website called docereapp.com, but again, most of the because we have our own system which usually flags people that are not physicians, for example. But everyone that wants to be part uh, of the platform and is thinking about joining us or trying to see if it can be a fit in the future, or even just trying to experiment or to work with the platform, please reach out to me. For physicians that want to be part of the platform, again, please reach out to me because we have the onboarding process, which is very easy, and I do it myself. And I'd love to talk to you and figure out how can we integrate the platform into the clinic and to the already existing some tech platforms like EHRs and everything. So I'm usually the biggest help with this stuff. So it would be easier to reach out to me. But for anyone that just wants to check the website, docereapp.com.
Amazing. Luca, thank you so much for joining us today. I learned a ton. You're doing some impressive work in a system that truly does need people that are trying to do it in the way you're doing it in a collaborative way, looking for ways to help reduce time, reduce overhead, give back time and efficiency to the doctors, but also the patients. Thank you for coming on the Pitch Please podcast today. Thank you, everyone that joined in. Luca, any closing words on your side?
I have just the last thing that I'll do is use the wording of Charles Bukowski. Who I use it all the time. Actually, it says, I actually, you know what? I'm going to change it this time. I'm not going to use Charles Bukowski. I'm going to use Thomas Friedman, my favorite economist. He says, pessimistic people are usually right, but optimistic people change the world. So be optimistic and change the world.
I love it. That's super positive thinking. And I think it's something that all entrepreneurs need to keep in mind every single day, especially on those harder days. Luca, again, thanks again for tuning in. Everyone that listened to the Pitch Please podcast today, thank you for tuning in and catch you on the next episode.